or last week for recording for me. Okay, so we're going to do tick bite protocol. Okay, this is not necessarily the whole, this is not the whole Lyme's protocol, talking about the tick protocol. Okay, so why, I guess maybe just we should briefly say, why do we want to know about tick protocol?
To avoid spotted mountain rocky fever, Lyme
Yep.
disease, and all other tick-borne illnesses.
So we want to avoid all tick illnesses, yes. So Lyme's disease, Rocky Mountain spotted fever. Oh, there's a couple other ones. I forget the name of it, but there's a couple other ones that are all kind of related to Lyme's, which is why testing is so confusing. We'll talk about that. Yeah. Yeah. There's a couple, some of them just have a scientific name. They don't have a common name that are, I can't remember. Yep. Some of the side effects is you can become allergic to red meat. Yeah. So, okay, let me get my tick notes here. So here we're not necessarily doing the deep dive into Lyme's, which we will do. We're just talking about you are in nature, or your children, family member, somebody who's going to ask you for help, and this is what we do. So in general, when someone has a tick on them or embedded on them or swollen on them, right? This is one of the few areas where we basically just kind of freak out and we overreact. So this is one of the disease things that we do is called front heavy, meaning as soon as you notice anything, it's better off to jump all over it than let it to develop into any kind of problem. So the quicker we react, and the good thing about this is it doesn't hurt to overreact, you know. We'll talk about what that means. So if you notice a tick on somebody, different types of ticks, everybody should Google ticks in Nebraska. They'll have pictures of all of them. Depending on their life cycle, some of them are very small, some are almost not noticeable. Those are usually the worst ones, or depending on how old it is in its life cycle. So they don't all look like the little reddish things that we're thinking of. Some of them are black and almost look like a speck of dirt or something. So we have to be really, really careful. You know, if you have animals, this is the same protocol. You know, so number one thing, if we see a tick, we want to save it after we get it off of somebody. The reason is you can actually test the tick later for what disease it had. So it is important to put it in a Ziploc bag, because if you ever try to kill a tick, they're about unkillable. So you just, well,
Burn their legs off.
burn them, yeah,
Burn them.
yeah, yeah,
Their legs,
yeah. I've put them in wax and, you know, and just, man, they're just really tough, and they'll live in the little plastic bag for, it seems like, forever. So they're just creepy as heck. Oh, they? Okay.
That'd be like at least 70%.
Okay. So some things can kill them, but we want to save them. So we want to save the tick so we can, if it's our animal that got bit or us or children or anybody, that's one thing you want to tell somebody right away to save the tick. We want the area where the tick was at, if it was embedded already, then we want to be really careful about extracting it. We want to be very, very careful, very, very patient. Sometimes if you put alcohol on them really heavy, they can back out, and that's considered helpful. There are tick removal. They look like a little dog tag. Remember the dog tags, people? A tick key. Yeah, tick keys are really helpful. They're like just a couple dollars online. You can buy them a lot of places. Most camping places will have them. Should have them in your car, in your backpack. everywhere. It's like a safer way to remove a tick so you don't like break the head off in your body. So, everybody seen a tick key? They're just this little piece of metal. It looks almost like a, remember when people wore the army dog tags, like military tag? It just looks like that, the little hole in it. You just slide on the back of it and it just pops it out. So get your tick keys. They're very cheap. Shields has them, all kinds of places have them. Any camping supply place will have them. Okay, so we want to save the tick. We want to remove it very carefully. We want to look at the area where it was, either at when we found it. We want to inspect someone's body to see if there's any like red irritated areas where it might have bit and then moved up somewhere, because the really bad rashes and irritations, sometimes they can take days to develop. They don't always happen right away with some people. There's all kinds of people debate about what that means. Like, you know, if your immune system is stronger, you'll have a rash. If you have a tick-borne disease, you're supposed to be more likely to have a rash, but you don't have to have a rash to have Lyme's disease or tick disease. So some people never know you got bit, basically. This is why, like, when we interview people with chronic diseases where people have pain and joint problems and brain problems and neurological problems, this is always in the back of our mind that maybe they've never been tested for Lyme's. You know, almost everybody's had tick bites in their life. You can have a tick bite and be fine, and this could show up years later. You might just have a little bit of a speed bump and thought maybe you had allergies or a little cold. So once we notice the tick, we keep close monitoring of someone for a month, especially the first week, but we're gonna really pay close attention for a month. Anything suspicious makes us a little bit more reactive. Okay. We want to take a picture of the rash if there is one. Typically, it'll be a bullseye rash, meaning like the little tick will bite in here, but this rash can get huge. I mean, it could be your whole back. It could just be the size of a quarter. It could be huge. Do you want to see what one looks like?
Do we always get a rash?
Not everybody will get a rash. This is why this can be really tricky.
Does the rash work better?
Not necessarily. Some people say a rash indicates you high probability got something and your immune system's reacting. I don't know if people totally agree on that or not, but you'll get this ring like bullseye. Sometimes it'll have like tree rings. You know, it can be circular, can be a little wavy. It can kind of have like a general presentation like that, but there'll be some type of like a ring around the area typically. It's going to be very red. The more swollen it is, the more red it is. Yeah.
So I don't know these people, upstate New York, and my sister went to nursing school, and they had a big party out in the woods, and one of her friends had to potty, and she ended up with a huge bullseye on her bum. And had to go in and get treated for.
Yeah, so you can have, these things can get any, you know, ticks love to go like in the pant lines, the underwear lines, thighs, buttocks, they'll go anywhere. So, I mean, you have to kind of check. So we're looking for this to happen anytime, but especially the first week. If we notice any kind of reaction where the tick was or where we removed it, then I'm sorry to say you're going to go hyper vigilant. And you're going to, if this is a family member or friend, you're going to like shake them and say, you cannot ignore this. You have to medically react and you have to natural medicine react, both. Okay. So if anybody has an embedded tick and they develop a rash or any symptoms in the first week, you're going to go to the doctor and tell them, and hopefully they're a Lyme's educated doctor, and they're going to prescribe an antibiotic, and you should take that. It's, you know, even as natural medicine people, this is a lifesaver. It can really help people. A lot of patients that we work with could be allergic to antibiotics or reactive, so we still try to encourage them to try it, or help to reduce the side effects of the antibiotic. So if somebody's going to be on an antibiotic, what are we going to do to try to minimize the reaction or the side effects of it? No. So the first thing we're going to do natural stuff too, but this is like, this Lyme's and tick disease is so serious, we're just going to go right to medical intervention. And most doctors that are pretty well trained should not hesitate to give you an antibiotic. Okay. We're going to give somebody probiotics. Okay. So probiotics are the good bacteria. We're not talking about prebiotics here. We're talking about probiotics. Yeah. We only are concerned about probiotics. I mean, it could have other stuff in it, but the main thing is we want the probiotic to be in there. How much if someone's going to take an antibiotic? So a minimum for adults, 3 billion. That is like the lowest possible dose per day. That's the lowest dose you can get by. You can go up to 100 billion per day. Okay.
Do you have
What's that?
do you have any recommendations?
So probiotics, if somebody has already taken them in the past, we don't have the ideal stool test yet to know what probiotic someone ideally would benefit from. So it's a little bit of trial and error. So if somebody has already taken a probiotic and it helped their digestion in the past, we just use that one. If we don't know, then we do what's called a broad spectrum probiotic, meaning where it has the more varieties, the better. So we want something that has like 10 to 20 varieties. You want to see what that looks like? Let me grab one. Okay. So this one is this is just one of them that I use, is called 514, Flora 514. It's 14 varieties, 5 billion per capsule. So I'll pass this around so everybody can look at it. Not all probiotics have to be refrigerated, but sometimes they'll retain their potency more. You can get up to 100 billion. You can get up to multiple 100 billion, like if you get powders. Typically, there's not a benefit to doing super mega dose. So nice thing about probiotics, the only possible side effect is you might feel a little gassy or a little more regular stool if you get too much, but otherwise they're tolerated well. The only thing we have to look out for with patients with probiotics is we have to make sure they're not made with the food allergy they have. So for example, that's kind of why I tend to use this one. It does not have any, they used to say it on the label. It doesn't have any gluten. It doesn't have any legume. It doesn't have any corn, yeast, wheat, soy, anything. It's just kind of hypoallergenic. So a lot of probiotics are going to be grown on a dairy culture. So some people might be allergic to dairy, might not. I mean, so this one I'll pass around to is a 50 billion per capsule. So you can just kind of read labels and you can look at the varieties. So these are all the varieties, and then we'll get one for the camera when it goes around. Good. Okay. How much probiotic though? What's the rule? Do you know the magic rule? How long do we take typically, if you have a bite and you have a reaction or symptoms, you usually get a 7 to 10 day course of an antibiotic. Okay. What's the rule? How long do we take probiotics for with an antibiotic? Do you want to know the magic formula? Okay. For every day you're on an antibiotic, 1 week on a probiotic. That's how long it takes to get your flora back. Okay. So for every day on a drug antibiotic, we're going to do a probiotic for 7 days. So if you're on it for a week, then we're going to be on it for 7 weeks, right? This is not something you just take, and a lot of people stop when their antibiotic is done. A lot of doctors who have not studied probiotics will try to say, don't take your probiotic when you're taking an antibiotic. That's just not even science. That's not even clinical. So we take it at the same time and afterwards. Okay. Okay. If you still have symptoms after your antibiotic is done, and we'll talk about the natural stuff you're going to take with it too. We're going to do both. Then you go back to the doctor and tell them, I'm still having symptoms. And typically it's good to do another round to be safe if people are having a lot of symptoms. Okay. Okay. So this is kind of the protocol as far as like what the Western medical doctor is going to do. Do we test for Lyme's disease and things right away? We don't, because it's like a lot of immune things, it can take weeks or months for them to show up in the blood. So it doesn't necessarily help to run into an immediate blood test. So
Because they're not testing for the actual organism, they're testing for the immune response.
yeah. So, okay. So naturally, okay. So let's say somebody can't do an antibiotic because they're just allergic to it or something. Maybe their doctor won't recommend it. Or if you're on an antibiotic, you're still going to do this natural protocol. So the second that you get bit or see a tick on somebody and people have symptoms or a rash, you're going to start this natural protocol. Either way, whether you're on antibiotics or not, you can combine the two. It's recommended to do them both. Okay. The protocol is topically, this is really important, on the bite area or any area that is irritated or swollen or has a rash, we're going to apply echinacea. This is where we have to geek out. Echinacea, Angustifolia, only Angustifolia works with tick diseases and only the root. This is actually kind of hard to find if you have to go looking for it. There's many people who are clients that live in bigger cities out of state that we could not find this at any health food store in like New York City and other bigger places. Has to be Echinacea angustifolia, which is the one that's native to Nebraska. Root. Okay. This is the one that has the deep alterative effect that we want for tick diseases.
I have the tincture, so which is.
So we could either do the tincture of it topically is what I prefer because it's just easier for patients. So I just have patients, whether they're kids or adults, topically take the tincture and just saturate the area at least 3 times a day. If we can't find a tincture, you could actually get this dried from like here or a health food store, go harvest it. And we could do like a poultice on the area of from the dried herb that we could do. It's hard to find this as a capsule, but maybe you live somewhere where you can only find the capsule, then you would take the capsule, break it open, and kind of mix it with a little bit of water to make like a paste. But the tincture is my preference. It always seems to work better. It gets into the lymph and the tissue and the blood vessels better. It seems to have always had a better response. And also the rash tends to clear up really quick when you do that, which is always a good sign. So I prefer the tincture, not the glycerite, right? Okay, so topically, we're gonna do this, okay? This is really important. The whole area around it, you just overboard it, soak it, okay? Internally, I've really reduced the complexity of this over the years. Internally, we're gonna do the same. We're gonna do Echinacea angustifolia root. Internally, we got a couple options. This is still kind of hard to find. So we could do, just to review, we'll go over some dosing again. Again, when you buy it at the store, if it has anything else mixed in it or any other part of Echinacea, it's not going to work. It can't be purpurea, it can't be the flower heads, the leaves, it can't be mixed. Got to be straight, only Echinacea angustifolia. So, or let's do adult dosing and let's do kids dosing. Animal dosing, you would probably have to call one of the, look in a book or call one of the natural vets in town and figure out a dose, but it would be the same protocol. So tincture, this would be like the liquid extract. How much would we give an adult for this purpose? We're going to do 60 drops 3 to 4 times a day. Okay. What if somebody comes to see us or calls us and they saw the tick, the rash is already there, and they're big time symptoms like fever, chills, sweats, aches, lymph glands are swollen? Then what? Well, I mean, yeah, we would refer them to get their antibiotic, but we would do 60 drops every other hour they're awake for the first day. If they're really, really having major symptoms, okay? Just for the first day. And then we go to 60 drops 3 to 4 times a day. Okay. Typically, we don't give tinctures to kids just because they have alcohol. I mean, it's not a huge concern because there's just trace amounts, but just for conversation. We can get Echinacea angustifolia root glycerite. Again, it's hard to find, but we do have it, or you can get it. So the dose for adults would be the same. 60 drops, 3 to 4 times a day. What about for kids? It's usually about 2 ways we could do this. I want you to all to know this inside and out. If it's an infant, like your baby was out, or like, infant, we mean, anybody under like a year of age. Do you remember Clark's rule? Remember the dose?
Like a drop.
Per one drop per 10 pounds of body weight. So if you have like a young child who got a tick bite and a rash, you would do 1 drop for every 10 pounds of body weight, because kids are not going to weigh very much, right? So this is only going to be 1, 2, 3, 4 drops, 3 to 4 times a day. So 1 drop per 10 pounds body weight, 3 to 4 times a day. This is for someone who's just probably like a year or younger, maybe up to 2 years old. Okay. Once kids are over 2, they can go to a normal dose of 30 drops 3 to 4 times a day. Okay. And you're doing this with the antibiotic or not. I mean, we prefer people to do that if their doctor is willing. So, but either way, you're going to do this natural protocol. What about the tea? Oh, question.
Okay, so kids don't get that tincture, right?
I mean, you could, but
It's so strong.
yeah. How do we give kids tincture? What are we going to do? We're just going to put it in warm water or apple juice. I mean, there's not enough alcohol that it's going to affect them, but
And that will take a little, I don't know, numbness.
it's going to remember this. And remember, we tried this in class. This makes you salivate. It's extremely strong.
Does the juice or water help with that?
Nope, that will always happen. That's how you know it's real. What if we have a tea of this? Maybe we could get the dried root from the store or something. Not the best tasting tea, by the way. It's going to make your mouth kind of tingly, numb. So not like a high probability tea.
1 cup.
So we do, how do we, just to review, a little ultra learning, right? How many tablespoons? 1 tablespoon per cup, right? That's our general rule. And we're going to do 1 cup 2 or 3 times a day. Okay, what if all we can get is capsules, that's a pretty hard find. We do 2 to 3 capsules, 3 to 4 times a day, depending on like how good a quality they are. Okay. So the second you notice a bite, a mark, a reaction of any kind in the immune system or body, I'm going to start this. Okay. Don't wait to go to the doctor like the next day. Just immediately start it, even if it's before you go to the doctor. Okay. That's part 1. Part 2 is I've made this really simple over the years. Schwan Shin Lian, or sometimes this is called andrographis pill. Sometimes it's called antiphlogistic. This tastes horrible. You're not going to probably get it down for most people. So we're just going to do this as a pill. Typically, we won't give it to kids. Usually just do the echinacea for kids is enough. So, let me go grab a bottle, I'll show you what it looks like.
How do you?
Yep. So the Chinese is Xuan Xin Lian. Butchering that, but so it is a combination of the main two herbs in here are andrographis herb, which we talked about during colds and flus and bacterial infections, the beginning of class, and istasis root. So it has the istasis and it has andrographis. Those are the two key herbs. Graphis. Istasis, remember, kind of tasted like popcorn a little bit. It was kind of unusual, but the andrographis is intensely bitter and kind of gross. So we tend to just do it as a tea. You can find from Chinese medicine places powdered teas of this, but what happens is it's so bitter, they put a ton of sugar in it to cover the taste up. So I'll pass this down to Xuan Xin Lian. If you don't have access to that, you can get just istasis, like from Prairie Star or other places. If you're in a hurry and you can't find something, istasis is one of those herbs we talked about, right? Yep, that was the woad root. It's kind of like, it's used in Chinese medicine, but remember we talked about it's used in European history big time. So istasis, it's like a stronger version of echinacea. So how many of those pills do we do? Even with an antibiotic or not? Either way, we're doing the same dose. We do 2 pills 3 times a day.
This with, so you just, all this with the antibiotics as well.
Mm-hmm. If we do the antibiotic, we're going to take a probiotic. If we don't do an antibiotic drug, we don't have to take a probiotic. Okay. Okay. Questions? We're going to monitor for 7 days, really diligently, making sure things don't get worse or flare up with any kind of bite, or even if we notice a tick, we're going to watch for 7 days hyper vigilantly. And again, the problem is sometimes, ticks bite in like the groin and buttocks and places like that. So you've got to get in the mirror and check yourself out, right? But we are actually going to monitor ourselves or whoever we're helping for 30 days.
What happens if something happens?
If
in the-
anything goes in 30 days, we're going back to the doctor if it's intense, and we're also gonna restart the protocol. So we would do this protocol, the natural one, for a minimum of 10 days. I always tell people, even if you didn't get a bite, you just found a tick, it doesn't hurt to do this natural protocol. That's the nice part about it. It's not dangerous. It's very safe. So even if you just found a tick and you're really worried, or maybe you've had Lyme's disease yourself before or a tick disease and you want to be hyper vigilant, you can still do this for 7 days or a couple days just to be safe as you're waiting to see if any symptoms happen. Okay. Okay. They can reflare up anytime.
Also, we get it. When
You can get it again. Yeah. 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 So it's oh yeah. So the question is, you can get Lyme's disease multiple times. If you've gotten over it, you can get bit again. And typically people that get it a second or third time, it tends to react. I've noticed a lot right away. Was that the case with your sister?
My sister, the second time she got it, she worked in a hospital and she got a headache to die for it. She went to the emergency room. And so I got a really large lump on my arm that I thought it was a spider bite. My dad got a rash in his groin, but my sister never got any kind of bite. But she had just a crushing headache.
Yeah.
Went to the emergency room, her blood pressure was extreme, and they sent it off, and she tested positive for Lyme. That was the second time. I don't know the details of the third time.
So we don't wait for testing to treat, by the way. We don't wait because testing is when we cover Lyme's disease and that like more in depth, like it's this very murky topic. You know, you thought COVID testing was a big contentious debate. Like this is like really huge debate that doesn't have a lot of clear answers, and every expert has a little different opinion. So we don't wait to treat, we just go for it. Okay, so maybe to review, because sometimes some medical people or other family members might not know all the symptoms we're looking for. So what are we monitoring people for? Any kind of typical flu-like thing, right? Chills, sweats, fever. We're looking for any kind of skin rash. We're looking for the bullseye rash, right? We're looking for any kind of major skin just reaction, allergy-like looking reaction. We're looking for, like Janine said, headaches are a huge Lyme's tick symptom.
I would say the number one symptom for Lyme disease everybody I've ever talked to.
Yeah.
You were
So
just so tired, you
Yep.
you could sleep the entire day. And that's early and late Lyme. That seems to be the number one thing that I've seen everybody have.
yeah. So she's saying fatigue, brain fog, even memory loss. Sometimes people almost act like they've had a concussion where just like their eyes look really glazed over. Muscle aches and fibromyalgia kind of aches, joint pains. Headaches can be debilitating, very bad.
You also have cough. People can have cough. I have cough.
Cough. Any kind of lymph gland swelling. And it could not just be your neck. For a lot of people, it's their groin. One of the clients that has been one of the slowest to respond to Lyme's, his testicles swelled up about 2 or 3 times their normal size. There was like discharge, bleeding, all kinds of severe lymph gland swelling in the groin. It took him a long time to kind of figure out what it was, you know, because of course they thought it was like an STD at first or something, and went through that whole progression, which, you know, he's married. That's not the best thing on your relationship to be accused of stuff like that. So, yeah, there's just weird things can happen. What else? There's cough, neurological.
So, there's something, they're probably, I don't know how much you want to hear, but it just, if somebody's had a tick bite or this is what I say, if somebody's had an insect bite and it's ugly, I would just go in and ask for an antibiotic just to be safe, because if you catch it early, most of the time it really does get rid of it. But it's called the great mimicker because it just seems like so many things. And I guess one of the other things with Lyme is it can be very transient. So like I remember I was driving and I had wrist pain to the point where I like had tears running down my face, and I had to pull over. My twins were babies, and I'm sitting in the car, those before cell phones, and I'm like, what am I gonna do here? And then it just stopped.
Yeah. So we remember how we talked about in flus and that, how we have this intermittent concept, remember, like symptoms can just, you can feel like you're getting better and people quit taking everything and then It just hits you within a minute or hour, it can just all come back.
There's specific antibiotics for all.
Usually it's doxycycline. I'm not like a drug expert, but I think that's the first thing they do. But
Nicholas,
yeah.
is it helpful to do the protocol if you had a tick bite years ago, but you never sought treatment and are asymptomatic?
So the question is, if you had a tick bite years ago, but have never really seemed to have a lot of Lyme symptoms and are still not having Lyme symptoms, it's hard to say because Lymes can mimic anything. So it doesn't hurt to do the protocol. If you do the protocol and you get a reaction, that's often a concerning trait.
What kind of-
Meaning like if you don't think you've ever had Lymes, but you're like, maybe I'm just gonna try this because I have been bit by ticks years ago. And you get a reaction to this, like you get sweats and chills, it's possible, it's kind of like leaning towards the idea maybe your body has fought it off for you, but it might be latent. So it doesn't hurt to do it, at least for like a week.
So if it's late, they rise up with the protocol.
You can get some Herxine, and remember we talked about Herxheimer reactions. Because some of it dies off and then your body reacts.
And
Mhm.
monitored, she got no rash, but
Mhm. The other symptom that's very common is, besides headaches, that a lot of people don't associate with Lyme's in the Midwest, is all these neurological problems like memory loss, vision changes, dizziness, facial tics and spasms, numbness in the face or parts of the body, like you have like nerve damage, tremors, nerve pain, like neuropathy pain, like burning nerve pain in different hands or feet or parts of your body. I've had people who couldn't even control their tongue, like couldn't speak very well. This thing can do anything. So I'm not trying to scare everybody. I just want everybody to be just better to proact. It's always better in natural medicine to be proactive than reactive, right? We want to be in regulation of the process instead of having the process regulate us.
I read an article about the red meat one that was here in Nebraska. They profiled somebody. And she had gone mushroom hunting, I think is what it was, and then later on, I don't know how many days later, had a hamburger and felt like she started to have an allergic reaction, and she did go to the emergency room, and they said it was a good thing she came in. So that would be another thing, if you've had a tick bite and you haven't had anything abnormal, but you feel like you're having an allergic reaction, that would be something you'd want to tell.
Yeah.
I don't know how many days apart it was. It wasn't the same
So
day. Maybe
people can react to red meat. That can be a sign of certain tick diseases, for sure. What was I gonna say? I lost it.
they're nasty little critters.
Oh, just because you don't go outside doesn't mean you don't have one. I know a couple people who got Lyme's from an animal that they let roam in the backyard, who got it, was on their couch and got bit, or in their house somehow. So animals can bring the ticks in the home. And so just because you're avoiding like nature or being super cautious doesn't, I have known a couple people that got bit in their own homes because of animals.
I've watched a tick climb off the cat onto me.
Oh, yeah.
Well, I've gotten to off my walls this year.
Yeah.
You got some off your walls this year. Yeah.
Like,
Can we get them
all
off?
and things like that help protect you from a ticker.
Pictured in and.
I mean, I
proactive?
think the FDA or somebody says that DEET, which is very toxic, can be a tick repellent, the DEET. But it's not FDA, there's some weird somebody regulates claims about bug sprays. I think it's the EPA. It's not the there's some weird thing. The EPA, I think, is who does this, has said you can claim that DEET helps. That's not, doesn't guarantee, but also the whoever this government body is, they do have tested and proved that lemon scented eucalyptus is somewhat of a tick repellent, but I mean, it's not like a perfect art.
There are some wonderful natural ones that work really good. I don't like to.
Yeah, there's a lot of.
Well,
there's.
there's
that.
hella oils you
Yeah.
can make your own that are
Yeah.
really good, and you have to apply them more, but they
Yeah,
work.
that's-
How do we
It's
find
better
them?
than-
Yeah, I mean, how do we know? You want to put in a group?
You wanna have a
Yeah.
class? Do you wanna make a class? and
Yeah,
do it?
something.
We should do natural bug spray part of class soon. That's a good one to know. Yeah, there's like, cedarwood and citronella and a bunch of different things, peppermint.
All
Yeah.
the essential oils that are really
Yeah.
good. I can come up with a little. I
But you-
can post it. something
Yes,
on it.
please.
Yeah.
Yes, yeah.
But you gotta reapply and you gotta do a lot of it.
What? She does classes in it.
We can do a margarita.
Yes.
Margarita.
Well, I do always do a margarita.
So the thing to remember is whether it's natural or like unnatural bug spray, you gotta do a lot of it and that's gonna reduce your odds, but I can't tell you how many times I found ticks on me and I just been drenched and stuff. So it helps.
It helps, but they can crawl under your clothes.
Yeah.
and You can't spray 100% of you,
Yeah.
so they're tough, but it does discourage them.
And they will move. I mean, they did studies where they'll move away from different scents and things. So, but just don't get like too confident. Oh, I got my spray on. I'm totally protected. And Nia said, if you've spent a lot of time in nature, you'll notice that sometimes you won't have a tick forever. And you can walk through a patch of grass and brush up against, and you could have 30 ticks on you in like a couple seconds. Just anywhere, like, I mean, more wooded areas and lake edges and stuff, you're gonna find where there's animals congregating. Birds. So, okay. So don't despair, but when we see tick, when you have a friend, a family member, yourself, a client, just you want to like implore people to act right away.
And everyone sitting around me has to check my hair every day.
Yeah.
That's where you'll find them, hair, face, neck. If you see something, say something.
Also, Nicholas, I think it's true that the majority of people who get Lyme's don't get into the neurological manifestations, and so, but you don't know which group you're gonna be in, so it's always better to be more.
I think the majority of people that I see, probably because they suffered more frustration from the medical world, probably have like more neurological stuff. That's the part that's, I mean, really making adults cry. I mean, it's the thing that's just wiping them out. But I think everybody has fatigue as like a main symptom too, though. I don't think I've ever seen anybody who had great energy with a tick disease. So, yeah. Yep. And anxiety. You can also have anxiety and depression. Good. We got a pretty good list of this here. Okay. So we will cover next year Lyme's and Lyme's protocol. It's very complicated just because you have to be able to chase all the manifestations in every system that it's targeting. It is just a basic natural medicine concept that Lyme's, like any infection, is going to go to your weakness. I mean, it can affect your kidney, it can affect hormone, it can do all kinds of things. So I hope I gave everybody a really,
Thank you.
Important one.
oh yeah,
Can affect your heart rate.
It can affect, yeah, and it can,
It can give you either elevated heart rate
Yep.
or slow heart rate.
and it can give you heart problems, like medical heart problems. So. Okay, so everybody knows the tick things. It is in Nebraska. All of these, I don't know if all of them, but like limes and Rocky Mountain, all these things are here in Nebraska. For years, a lot of doctors tried to say they weren't, even though people were tested positive for a long time. But the state government has admitted it now that it is here.
My son got it in Grand Island last several months at the same time. And they had and they came to the doctor in Omaha and they reported it to the health department. That health department went to Grand Island and combed the area and discovered Lyme. So, I mean, they're really on it.
Yeah, so they finally started admitting it. Oh, that's good. So your son triggered the first actual like
Well,
testing?
I don't
Oh,
know if it's the first, but
Yeah. because people reported it for years, but what would happen is doctors would report it, but the state and local county health authorities say, nope, it's not here. And it would just like stop the conversation. So it really,
They did with COVID too.
yeah, so education was like a huge issue for many years that they couldn't even, yeah, I don't want to get into it. I can't tell you how many people suffered unnecessarily in our state here. Okay, or they would just say, well, okay, you have Lyme's. Okay, well, clearly many years ago you went to like New York and went to New York City, you know, therefore like you have, that's where you got it. That's where you got it. You didn't get it in Nebraska.
How long
So-
after a tick bite can you safely presume you made it free and clear?
I don't know the answer to that question. Like, I would just say in my experience and watching a lot of people, you know, 30 days is, but I mean, it could be, you know, a latent thing. So I don't know if you ever know for sure, but
But
it's
30 days-
really good. It's really good prognosis if at 30 days you don't notice anything. Yeah.
My cat.
Yeah. But not a guarantee, but it's good. Okay, so any other limes or tick little tidbits online? Okay, okay, let's stop that and then let's record.